Hi, my name is Deborah Santos, and I'm a senior nursing student at Cedar Crest College. This video is my summary reflection for my Nursing 335 leadership class. And the purpose of this video is to explain how I met each of the objectives that were required for this course. Number one, utilize previous knowledge of the sciences, liberal arts, information technology, and nursing to develop skills as a nurse leader. The way I met these objectives was by signing up for the peer leadership in mom baby, in mental health, and the health assessment lab. I first started off with the health assessment lab, and there I helped the other students with the vital signs. They're first learning how to take vital signs. They're not comfortable with it. So I explained to them that I too was in their spot a year ago and that they will understand it just as I do. And I helped them out step by step, especially with the blood pressures. That's one thing, that's one area where they were having trouble with. I also helped them take respirations while you would take the pulses, because that's another area where they were a little bit uncomfortable with. And I was satisfied because they felt like they learned a little more. You know, a student that has been in their shoes is teaching them. So they were able to continue practicing. I also went to the mom and baby unit with Professor Gogol and Professor Wagner, clinical group. With Professor Gogol, I helped the students look into the mother's charts. I also taught them how to give the SBAR report and taught them things that the teacher would expect from them and what they would ask according to their patient. Excuse me. I also gave them ideas on how to create or come up with their clinical case presentation, and I saw that they appreciated that as well. And I also, like I said, I reminded them that I was there in their shoes before, and just as I could do it, they could do it as well. I was also in a mental health peer leadership clinical with Professor Mercadante, and there I helped the students practice for their videotaping, which was a scenario that they had to do between a nurse and the patient with a mental health illness. They read me their scenarios. I told them how to implement therapeutic communication and the other areas that might be helpful in maintaining the length that's required for that video. The second objective is apply the basic principle of ethics and management to meet the challenge of an ever-changing healthcare environment. I worked with two people that were in management. One was Nicole Grossman. She's a part of the Infusion Center. And I felt very fortunate to shadow her because, yes, she's a leader there. She's, case management, but she's also humble. And what I experienced there was that there were some of the employees, other nurses, that had trouble, for example, with the facility. And what I noticed that Nicole did was that she listened, she let her vent, and she asked her, is there anything that you would like me to do right now for you to fix this situation? And the nurse was just satisfied by her listening and her asking her if you need anything. So that was she handled that pretty well. Another person was Tina. Tina was a nursing supervisor, and I followed her on the new nursing supervisor role at Cedar Crest College. She is an elderly lady. She was amazed by her mentality and how strong her memory is. She's an 82-year-old lady, and she supervises at Cedar Crest College. And I saw how she just walks everywhere throughout that big hospital, and She went on to each floor, asked what the census was, and, before leaving each floor, she asked if they needed help with anything. And she also asked if everything was okay. So I think that was very important of her to do, and also offering herself as, playing with the team. Just like Nicole, she, they were short staffed there, but she wasn't one of those managers that just stayed in her office and let them, fend for themselves. She was there. She got her hands dirty. She helped the other nurses out and whatever else they needed help with. And she did it in a calm manner without attitude or any anger. The third objective is demonstrate leadership skills through effective use of communication by representing self, the college, and nursing in a professional manner. I believe the way I did this was emailing the people that I needed to contact before going to my leadership experiences, and I asked them what were their expectations of me, what is it that they require from me, and I also let them know that I was looking forward to the experience. I then, when I went to the site, I presented myself as the nursing student from Cedar Crest College. I went with my nursing school ID, if that was required, or my lab coat or my uniform, just to represent the school, just as it should. I also, after the experience, I gave my business card, and I also wrote them a thank you card. I bought thank you cards for most of my experiences, and for some I emailed. I got the idea of doing thank you cards after. So I wrote thank you cards telling them that I enjoyed the experience, telling them that I appreciate their time that they gave me, and also reminding them that they're great nurses and they're making a change to the environment. Objective number 4, I looked up a research paper pertaining to this. Objective number 4 states, critically evaluate and disseminate current research related to the principles of leadership and the effects on the healthcare system. The title of my article is Organizational Leadership for Building Effective Healthcare Teams. So this article is about, it talks about how leaders need to train, support, and value their team. They shouldn't just micromanage. It also says that leaders must create an environment according to the needs of the patients to be able to provide quality care. Along with this, as I said, training is important. Valuing the teamwork is important. Communication is important as well, and involving teams in decision making and create a culture of safety. I believe that if your team is happy, then the patients are happy. Then they can reduce medical errors. The quality of care for the patients is improved, and you overall get a good day of work. Also, with being a leader, you should plan out the day according to what this article said. You should plan out the day. Tell the teamwork what the goals are, and also get your hands dirty as a leader. As a leader, I believe that it's good, to serve others, and it's not just you being served. Also, creating a culture of safety. Creating a culture of safety will reduce medical errors, and it can eventually reduce burnout and compassion fatigue. So it is very important for leaders to maintain a good, healthy relationship with their employees. Granted, there's some cases where you can't satisfy everybody. That's understandable, such as a schedule change or something like that. But nurse leaders, like nurse managers, they should definitely create an environment where everyone's mostly happy and they can work together effectively to be able to provide the best quality of care for the patients. Objective number 5 states function as a competent patient advocate, nurse advocate, and change agent. And I believe we met this requirement by going to the Capitol Hill Day. We went to the Capitol Hill Day. We advocated for nurses. One thing I mentioned was that Lehigh Valley and St. Luke's have signs everywhere for tobacco-free, no smoking, big signs everywhere. You cannot miss it. However, they only have a small sign that says no guns allowed. So my question was, what plan do they have to protect us, the nurses, also the other staff of the healthcare, as well as the patients from intruders, people that come in with guns? Is there a way that they can do something to prevent that from coming in, firearms from coming into the hospitals, such as putting metal detectors? Because I've seen other hospitals in other states where in order to get into a hospital, you have to provide your driver's license and you must go through a metal detector to prevent anyone bringing in firearms. That advocates for patients, for nurses, and just for anyone else who goes in the hospital. Objective number 6 says formulate plans for continued personal leadership growth and development as an independent practitioner of nursing and contributing members of society. With this, I met this objective by joining a planning committee of the MNSO. It stands for Multicultural Nursing Student Organization for Cedar Crest, and that encompasses nursing students that come from diverse backgrounds. We all know that Cedar Crest is predominantly white, therefore other students of a different background, like Hispanic, Black, Asian, they feel a little intimidated by seeing a predominantly white population. So this organization is being created to be able to give these students a voice and take away that intimidation that they might have because of thinking, maybe I have to work harder than everyone else, or, they're not going to listen to me, or they think that I'm not smart enough. I also went to a dine and discuss meeting, and there was a speaker that really touched me because I'm a mother. She had a daughter that was in the care of a hospital, and they neglected her, and because of the neglect, there was a lot of medical errors, and as a result of that, her daughter died. So what I learned from that is that nurses should write good notes. They should always advocate for their patients. They should see who comes in and out of the rooms, and they should listen to the patient and the family, because ultimately the patient knows best. The patient knows their body best. We don't. Such as like their signs and symptoms. For objective number 7, it says recognize the role of a nurse in policy making related to healthcare services at local, state, national, and global levels. Again, that was achieved by going to the Capitol Hill. And we were very fortunate to go there because we see how important it is for change to be made in healthcare, such as nursing, practitioner nurses being able to practice on their own, and also the nurse-patient ratio. Objective number 8 is predict and describe potential ethical dilemmas within clinical, organizational, and professional nursing practice. I believe that an ethical issue would be a child, maybe 12 years old, that is in critical condition and wants a blood transfusion. However, they come from a Jehovah's Witness background, and their mother or father says, no, we don't want them to get a blood transfusion. Where do you draw the line there? Like, what do you do about that? Do we listen to the mom, or do we listen to the child? That a 12-year-old can knows what they want with their body. They want to live. So that's everything, and I hope you liked my video, and I hope to continue on in this journey. I'm looking forward to graduating soon. Thank you.